Thank you, Deputy Speaker. March is Endo Awareness Month, and endometriosis is an extremely painful disease affecting around 1 in 7 Australian women and teenage girls. It's a long-term inflammatory condition where deposits of tissue similar to the lining of the uterus are found outside the uterus, on the bowel, bladder, ovaries, and causes significant pelvic pain. It can lead to issues with infertility for a third of those affected. Endometriosis can have a profound and debilitating and life-threatening impact. And as women cannot prevent endo, and as I said, it's extremely painful. There is no cure, and it can have life-changing effects on women. Currently, it's not known what causes endo, and it can only be effectively diagnosed with surgery. I was very proud when the Coalition introduced the first ever National Action Plan for endometriosis. I'm also proud that Australia was the first country in the world to enact a National Action Plan for endo. Awareness and education, the first ever clinical guidelines for endo, a digital platform for endo research, and support, management, care and research as the focus. Our plan has been copied by other countries. Australia is a global leader in this field, and in government the Coalition also supported pelvic pain clinics and the Pelvic Pain Foundation education into schools through their PEP talks. It's taken us many years to get to this point, and I understand the first time endo was first raised medically was in 1893. And I acknowledge the bipartisan work of the Parliamentary Friends of Endo and my Coalition colleagues who worked tirelessly to keep endo at the forefront of health considerations while we were in government. I'm also grateful that the current government is continuing to support the National Action Plan. And can I acknowledge the groups and individuals who continue to work on endo and thank them for their dedication. Women have historically waited at least 6.5 or more years for a diagnosis. At a recent Parliamentary Friends of Endo event, we were told about women who currently have to see 4 doctors at least to get an accurate diagnosis. Can I also acknowledge the great work of Professor Jason Abbott, who's involved in training health professionals in endo. It's important that I understand that only around 5% of GPs are adequately tooled and trained to actually deal with endo. And I want to also thank Endo Australia Board Member Associate Professor Anush Yazdani, who is a leader in surgery and reproductive endocrinology. I also want to encourage women with endo to sign up to the Australian National Endometriosis Clinical and Scientific Trials Registry. I mean, Australia is the best place in the world to do endo research. Now, this site aims to build a complete picture of how endo affects people's lives. It's a research network made up of clinicians, healthcare providers, scientists, patients and consumer reps who are determined to fill gaps in endo research to improve patient care, better treatment options and more affordable medicines. Next has 1,800 women on their registry, and as I said, please, if you women have endo, please sign up. You could help lead to a breakthrough to improve the understanding and hopefully one day lead to a cure. Endozone is a site as well that women can explore to actually look at endo basics. It's a collaborative of endo-active groups and researchers. As I said, Endo March, please join in. Wear something yellow. In Endo Australia and worldwide, they're lighting up venues in yellow. There'll be endo high teas. Come up with your own Endo March activity. And I know we have a plan in this place with the Parliamentary Friendship Group as well. I want to really, I've been out there campaigning for a pelvic pain clinic, 1 or 2 in my electorate in the southwest of WA and for the southwest, and I want to see more of those PEP talks for young women to know what the symptoms are, and I want all GPs to take them seriously. So I want to also thank my daughter Kylie for letting me tell her very personal story that helped to lead to this first ever national plan for endometriosis. It was tough for her to do, and all of those other incredibly brave and often long-suffering women with endo who've worked with us over these years to help tackle endometriosis. Can I encourage you all to get involved with Endo March and keep working on a cure for this disease?